Hello. I want to chat about National Minority Mental Health Awareness Month, specifically focusing on the African American community, mental health, grief, and loss. So, what is mental health, you may ask? So, when we think about mental health, I encourage you to think about the biopsychosocial, spiritual, and economic standing that we each possess. So, biological includes our origins, our family, our history, psychological, our mental and emotional states. Social, how we connect and relate to others, spiritual, if we observe or recognize religion within our lives, or spirituality of some sort, and economic status has to do with how we identify within the larger society. When we talk about the social determinants of health, our economic standing is a huge factor related to that, as well as our mental health, which we're talking about. And so our mental health is active at every stage of life, including childhood, early childhood, as far as into our later adulthood. And our mental health affects how we handle stress and relate to others, and it also influences our choices, which is why we want to aim to maintain our mental health to avoid mental illness. So our mental health and even mental illness can affect how we think, feel, and act, which is related to behavioral health. So, what is behavioral health? Well, our behavioral health is just how we react, or respond, or lack thereof, a lack of a response or lack of a reaction. Either way, it's a response to external stimuli, often found within our environment. And so, our behavior health is related to how we respond or react to various life events. As I mentioned, this presentation is centered on our mental health, grief, and loss. And so our behavior health is going to affect how we respond to those life events. And when we often talk about loss, we immediately may think of dying or death. But loss also encompasses non-death losses such as relationships, tangible items, maybe our home, our car, our favorite pen, or something that someone gave us that was deeply meaningful, and losing those any of those items, even our financial resources, can affect our behavior health and our mental health. And so we grieve those things if they are meaningful. And so our behavior health, again, is influenced by our mental health. And so, again, our focus today is specifically on the African American community, which grief is often overlooked and misdiagnosed as depression, many times within minority communities. And so the risk in that is grief unacknowledged or even masked, for safety most of the time, can lead to a greater risk for poor mental health and physical health outcomes within this community, which we want to be aware of. Keep our eye on that, or those things. And so African Americans are, because of all the things we mentioned, are less likely to share their grief with others, or even to seek mental health counseling or bereavement counseling at that. Thank you for joining in today. Just wanted to share and spotlight Minority Mental Health Awareness Month. And so if you would engage with us, and we like to keep the conversation going.